Hello, everyone, and welcome to our USMLE Prep series. My name is Aisoon, and today I'm joined by Dr. Aqsaa Chaudhry. Today she'll be breaking down the USMLE question that we posed on our social media back on December 2nd. So without further ado, go ahead and take it away.
Of course. So on the next slide, you'll see, today we're going to be talking a little bit about TB management. You see my name there, Dr. Aqsaa Chaudhry. I'm with my wonderful co-counselors, Dr. Russell Heckburn and Dr. Dwan Kinchlow. We work towards helping students study for their MBME exams, their USMLE Step exams. And if you guys have any questions or you just want some general advice, you can always reach us at usmle@mail.sgsm.org. So let's get into the question. So a recently immigrated 45-year-old man from China comes to the clinic due to fever, cough, and night sweats. He's lost 6 kilograms, about 13.3 pounds, over the last month. He does not recall any recent exposure to any individuals with similar symptoms. Chest auscultation reveals bilateral crackles at the apices of the lungs. The acid-fast bacilli stain is positive for Mycobacterium tuberculosis. The patient is diagnosed and treated with the appropriate regimen. Which of the following vitamins need to be administered in conjunction with this medication regimen? Is it A, vitamin B1, B, vitamin B3, C, vitamin B6, D, vitamin B9, or E, vitamin B12? So as I was approaching this question, I would read through it, and I would actually begin with the last sentence just so that I know what I'm looking for in the vignette. So the question here is pretty straightforward. Which vitamin do we need to administer in conjunction with the medication that we're giving him for his TB infection? They were nice that they gave us the appropriate diagnosis. We didn't have to come up with our own, but in certain situations, they may not give you that. There was an acid-fast stain positive for Mycobacterium, but from the other clues in the vignette, you would still be able to arrive to the same conclusion. Recently immigrated from China, night sweats, cough, weight loss, all of those point towards a TB infection. So from our social media accounts, what were most of the answer choices?
So we had a lot of people commenting C, vitamin B6, but there was a few people trickling in with a few different answers. So I think it'd be nice to kind of break down maybe each answer and why it's wrong or why it's right.
Of course. So let's talk a little bit about the correct answer. In this case is vitamin B6, so most of you guys did a great job. Now, the explanation here is that the patient's presentation's diagnosis is consistent with tuberculosis that was given in the vignette. The treatment regimen would include rifampin, isoniazid, pyrazinamide, ethambutol. And isoniazid may lead to peripheral neuropathy or sideroblastic anemia, both of which can be prevented by giving patients vitamin B6, also called pyridoxine, in conjunction with the isoniazid. So the other options, the other vitamin deficiencies do not really occur with any of the pharmacotherapy that's indicated with tuberculosis. So a little bit about Mycobacterium tuberculosis. There are acid-fast rods. Symptoms will include fever, night sweats, cough, which can be productive or non-productive, and hemoptysis, or coughing up of blood. The cord factor released by Mycobacterium tuberculosis actually activates macrophages, which leads to granuloma formation and the release of TNF-alpha. So on the left side here, you can see that this is what a typical stain would look like if you were to do that, in your infectious disease specialty, or if you're doing a rotation in infectious diseases, you may come across this. So the typical treatment for tuberculosis is the RIPE therapy. Rifampin inhibits DNA-dependent RNA polymerase. Isoniazid will decrease synthesis of mycolic acids, which is a part of the cell wall of Mycobacterium. Pyrazinamide, the mechanism of action is uncertain here, but it does help to potentiate the effects of the other medications. And ethambutol decreases carbohydrate polymerization of the Mycobacterium cell wall by blocking arabinosyl transferase. So isoniazid actually has some pretty serious adverse effects. It can cause hepatotoxicity, inhibition of the CYP450 system in the liver, possibly drug-induced SLE, anion gap metabolic acidosis, vitamin B6 deficiency, as we've discussed in this vignette, and even possibly seizures. So why do we need to give B6 with isoniazid? So under normal circumstances, pyridoxine would be converted to the active form pyridoxal 5-phosphate by pyridoxine phosphokinase. But when isoniazid is given and it is dehydrogenized to isoniazide hydrozones, that can inhibit the enzyme that converts pyridoxine or vitamin B6 into its active form. The role of pyridoxine in the body is quite vast. It is a cofactor in many transamination processes, which would allow for the conversion into ALT and AST. It's also part of decarboxylation reactions, cofactor for glycogen phosphorylase. It's also involved in the synthesis of glutathione, cystathionine, histamine in the heme process, as well as niacin synthesis. It's also involved in neurotransmitter production, so your dopamine, your epinephrine, norepinephrine, GABA, serotonin. So you'll find that pyridoxine is a very necessary vitamin for proper function within our bodies. So if you do happen to have a vitamin B6 deficiency, whether it's caused by medication or a vitamin deficiency, you could have hyperirritability, peripheral neuropathy, sideroblastic anemia, or even convulsions, as a lot of the neurotransmitters are affected by vitamin B6. So the other vitamins, vitamin B1, also known as thiamine, is a cofactor for several dehydrogenase enzymes. A deficiency of B1 would cause impaired glucose breakdown and can induce certain disorders like Wernicke encephalopathy, Wernicke-Korsakoff syndrome, and beriberi, which is a triad of neuropathy, muscle wasting, and dilated cardiomyopathy. And you'll see this more commonly among alcoholics. Vitamin B3, also known as niacin, is a constituent of NAD+ and NADPH+. It's used in redox reactions and as a cofactor by dehydrogenases. A deficiency of niacin would cause pellagra, which would entail diarrhea, dementia, and dermatitis, or the 3Ds. Vitamin B9, very important. It's a part of DNA and RNA synthesis. Deficiency can cause macrocytic megaloblastic anemia, possibly glossitis, but there's no neurological symptoms associated with folate deficiency. This commonly occurs in pregnancy. It takes a lot of work and effort to create a new human being. So pregnant women can be deficient in folate, and that can lead to some spinal atrophies. So you really want to make sure if you do have a pregnant patient that you put them on folate very early, ideally even before they get pregnant, so they're able to build up their folate stores. Vitamin B12, also known as cobalamin, is also important for DNA synthesis, and a deficiency of that can cause macrocytic megaloblastic anemia, similar to folate. But here you'll have some neurological symptoms as well, such as paresthesias or subacute combined degeneration of the dorsal columns, the lateral corticospinal tract, or even the cerebellar tracts, and this is all due to abnormal myelination. A prolonged deficiency can lead to irreversible nerve damage. So if you do have anyone that is vitamin B12 deficient, you want to start them on therapy. The earlier the better to prevent the neurological consequences. Here we have our references. As much as I like to say that I know all this information off the top of my head, that is not the case. But thank you so much for joining us today, guys. And any
Yes, just please be sure to follow us on social media. You can find us at SJSM_medical school. We pose these questions every other week, along with many other tips to help you better prepare for your USMLE Step 1 exam, as well as any other tips you can use definitely in your future to becoming better physicians. So again, thank you guys so much for joining us, and we'll see you again next week.